welcome to our afternoon keynote session here at our 2021 Virginia State of Reform Health Policy Conference. Super excited to have you all. I have the honor, the privilege of sitting in on all of these sessions throughout the day. I keynoted, or moderated one rather, with folks like David Herring, the president for North America, Pfizer's vaccine division. Got to hear from him about when we will be vaccinating our children and what that process for emergency use authorization has been like. I know we've gone over a little over 225 folks here today, and people are coming and going. We've got a couple of great sessions here in our afternoon keynote. First, we're going to talk about the 2021 legislative session, look back on that for a little bit, and then look ahead to the work that is in the interim between this session and 2021 and next session. Of course, we've got some elections to get through here first, but we'll talk about that. We'll also hear from Lieutenant Governor Justin Fairfax about his campaign for governor and how that is going, with the primary just a little over a month away now, so getting close. As is always the case, you can't do something tech like this without some tech problems, and of course we're working on that right now. We've got Senator Dunnavant with us and Delegate Sickles, and Senator Lucas has been with us, and we're going to get her back up on screen. But I want to jump in to the extent that we can, and I think given our tech setup and the way things work here, I think we've got Senator Dunnavant, who we can tee up and get ready to go, and Senator Delegate Sickles. We'll get to you here in a second. I'll just tell you, Delegate, you're going to get bumped over, because Delegate, that we're in a Zoom room together, even though our conference is in a different setup. And so as soon as Senator Lucas comes in, you're going to shift, and it's going to kind of muck things up. So, but we'll muddle through. So first, Senator Dr. Siobhan Dunnavant, thank you very much for being here. Member of the Senate Education and Health Committee, and of course, Delegate Sickles, who chairs the House Health, Welfare, and Institutions Committee. First, thank you both. Senator Dunnavant, let me ask you, tell us about how first, before you tell us about the session, let me also just say that for the folks here today, you may not know, but Senator Dunnavant was one of the first people we talked to when we started our process of getting organized here for this conference and for our reporting in Virginia at State of Reform over the last 6-7 months. And so you're really one of the folks who has birthed this and put more wind in our sails than almost anybody, Senator, so thank you for this. Tell us about how the session went and what your takeaways were from that run.
Thanks for having me on, and I am thrilled to be able to help you with this, because this is such a complex arena for us to figure out both how to solve problems and how to introduce policy to achieve that having a conversation like this with leaders from across the state helps so much. So we're so grateful for you guys coming into Virginia and doing this. Thank you. I would say for me in this session, that the number one issue for me was obviously COVID, as it was, I believe, for all of us. And for me, that translated to schools. In Virginia, our public schools were not open, our private schools were, and we knew that that was an unprecedented health risk to our children, for their mental health, for being able to learn with learning losses that may accumulate to 3 years. So my top agenda was to get schools open, and we passed legislation to do that. We also had to make sure those schools were ready to address the needs of the kids returning after that lapse in continuity. And so we introduced some legislation that will make sure we're measuring where the kids are with more diagnostic testing instead of high jeopardy end of the year tests with SOLs. We're going to break those up, diagnose where the kids are so that we can help individualize their learning plans and accelerate that rate of learning and catching up for those 3 years. I had legislation that I brought to the table about special education, which really needed to be revamped in Virginia. We were not helping kids that needed those kinds of special programs to actually get to the point where they could achieve to their capacity. So we are revamping special education along the guidelines advised to us by our Joint Audit and Legislative Review Committee. And then finally, vaccinations were an imperative for Virginia. When we got into session, Virginia was really struggling getting COVID vaccines distributed. We'd had a very efficient process to get it to the hospitals and healthcare workers, but getting it to 1B and beyond was really a challenge. And one of those challenges we identified was the capacity to both develop a process. This is something different than a health department ever had to do before. Develop a mass vaccination process, and that included volunteers and facilities, and it included some of the metrics which our universities stepped in to help with. So we passed legislation that left the Senate with every senator's co-patron signature on it, that basically mobilized all of Virginia to make sure we could get volunteers from every aspect of healthcare that were qualified to give vaccinations, to abbreviate their ability to participate in that process, to make all sorts of centers available for vaccination. And since that legislation went through with an emergency provision, we've had 35,000 volunteers step forward in Virginia to make sure Virginia gets vaccinated and we're getting the job done. So from a healthcare perspective, those were my big issues this session.
Senator Lucas, chair, of course, of the Senate Education and Health Committee. I appreciate you making it on. I know we had a little bit of a hiccup there, but welcome, ma'am.
I finally got on, and thank you so much. And I knew if Senator Dunnavant went first, that she was going to mention all of the issues that was near and dear to my heart as well. But I still have a couple more that I think I can mention. And she's correct. I think those issues surrounding health, and especially this has to do with our children, that we were all pretty much on the same page. But I have one more thing. I introduced Senate Joint Resolution 308, and it's to ask JLOC to do an audit and review to study the impact of COVID-19 on Virginia's public schools, students, and school employees, including number one, examination and determining reasons for barriers to student success in virtual and hybrid models, as well as the overall impact of COVID-19 on learning restrictions and previously existing student achievement gaps, student achievement, and student well-being, including any disproportionate impact on at-risk populations, determining the impact of the COVID-19 pandemic on staffing levels, including the impact of teachers and school employees, retirement and resignations, and on delivery of institutions, and the ability of local school boards to fully staff their needs in employment levels and local budgets. But you know what? I think that right now is a prime time for us to look to the next session, because I think with the article that was in the newspaper today at the federal level, where the president is going to be appropriating $1.8 billion to focus on education for children, for childcare and paid family leave, and the fact that I went to the bill signing with Delegate Sickles yesterday for the signing of the Speaker Fillicorn's bill that's going to expand child care and training to students, and especially those students who are at risk, which means that even though parents who are like within 80% of the median income will be able to qualify, the students who are at risk will be the ones who will be most targeted. So with that, I'll just wait and hear what Delegate Sickles has to say, and then we'll respond to your questions.
Delegate Sickles, that sounds like a pretty good tee up for you.
Thank you. Thank you, DJ. Thanks to everybody for tuning into this. We've continued, particularly, a function of our caucus emphasis on getting healthcare for everybody, to expand access and do the things that we can do to expand access, and also to keep people in their homes longer. And this year we had to, because of the minimum wage increase and other things, invest a lot of money into the rates we were paying home healthcare workers. Also, we are in the midst of still adjusting to managed care for almost all of our Medicaid program. We have two different programs that in this budget we merged together. They will be merged together. They're same 6 companies or the approved NCOs in each one of them. That may change as they do some re-procurement as it goes, but it will only be one program going forward, because they were profitable in the medallion side and not profitable in the CCC Plus side. And it didn't make any sense, since they were all the same companies doing this. There are complaints about managed care as we switch from being fee-for-service payers to an oversight agency. And there's been some pain with that. I think the DMAS has created some internal review panel so they can air these grievances a little bit better and make progress on that. But we are going to have joint subcommittee oversight hearings on this later in the year to look into managed care and how they're operating. We created a healthcare exchange last year, and this year I had another bill to amend that to allow the tax division to query people on a voluntary basis on whether they had healthcare insurance, so they can be followed up with by social workers. We passed a reinsurance program to help reduce the premiums in the individual market. That will be a program in the Bureau of Insurance. There's so many changes going on in Washington right now. I think many of the people on this Zoom probably heard some of that on your other panels today. That is going to probably delay a little bit the putting the reinsurance program into place, because it makes a lot of difference. It makes a difference to the federal government side where the subsidies are going. And if we were to make permanent the subsidy from the 400 to 600 federal poverty level, the numbers for the reinsurance program would be different. But we're really looking forward to getting that funded in the governor's outgoing budget. I had a drug transparency pricing bill that we're going to shake and bake the numbers from the wholesalers, the PBMs, the pharmacists, and the manufacturers to find out where the price on a large scale and an aggregate level, where the price problems are. Last year in 2020, this is not really this year's report, but we're able to bring people together to have a surprise billing resolution. And I think that's been going well, so that the people, out of network in an emergency room or other places don't get hit with these $10,000 bills we hear about in the newspaper. We passed Senator Dunnavant had this bill in the Senate, a reform bill to allow pharmacists to distribute or to initiate treatment of some drugs. That we passed it last year, and this year we added a few drugs that can be given according to these protocols that we had. So that should help save some money over time. And I could go over, in my role as on the appropriations, I could go over the things we paid for this year a little bit more if you had time, if anyone has any questions. But suffice it to say, we are working on making sure behavioral health reform happens, STEP Virginia gets funded, transition services, and the crisis in our psychiatric hospitals where we have 100% census, how to reduce that, and how to get people who can live in the community with supports back in the community. So they're very, very hard issues, very difficult issues. Human resources issues by definition are, and we have a system that is not necessarily the smoothest, fail-safe system to get services to our citizens.
I am reminded, Senator Lucas, of an adage I heard from a longtime legislator not in the Commonwealth, but in a different state. A longtime legislator said, "Forget what you heard. The enemy is not the Democrats or the Republicans. The enemy is not even the chamber. The enemy is the administration." And it sounds like there's a lot of bipartisan spirit amongst at least the three of you. How have you found working vis-a-vis the administration during this session? And maybe some thoughts on this administration and what it portends perhaps for the future.
Well, of course, I've worked well with this administration, and even though we have our differences on some issues, and I think it's unreasonable to think that we're going to be all on the same page for everything. So we've had some differences, but I think overall, working with this administration has been probably one of the best. I think it's been one of the most progressive, and of course, that's to my liking. And so I think going into the future, we can pretty much expect the same thing. We're not all going to ever agree on every issue. But I think overall, working with this administration has been wonderful.
Senator Dunnavant, how about that bipartisanship in the legislature? It didn't feel terribly bipartisan at the beginning of the session as legislators were thinking about, timelines and special sessions and all of that. But it sounds like a lot of good bipartisan work got accomplished. How would you describe the nature of partisanship in Virginia politics these days?
I think it depends upon what part of politics you're talking about. I am very fortunate to be in the Senate, and I have found that the two parties work very well together. There are obviously things that we disagree on, but I always legislate with evidence. And I am always looking at evidence, and I find that to be a nonpartisan, persuasive entity. And I think when we can build consensus, I honestly believe we care about the same problems and the same issues. We just often have a different way of getting to them. There are people that I work with throughout the administration that have been there through previous governors through now, that I work with to, you can't offer a solution to a problem if you don't understand how the system already works. So you have to work with the people that are already implementing what exists in Virginia, hear what their insights are to making improvements, and include that in the overall strategy for solving a problem. But it's the same, it's kind of like diagnosis. You have to agree on the problem. You have to get consensus among your peers that this is a problem worth solving. Look at the evidence about what might be the best solution and the best outcome. Stay focused on those outcomes and legislate that way. And for me, that is the way that I build bipartisan relationships, because I'm not trying to trade on emotion or, some sort of power surge. It's really about getting the job done right based on the evidence before us. And I find that a very consensus building place to be.
So Senator Dunnavant, give us a window into the back room, the caucus chambers, where you are a leader on healthcare amongst your caucus, and people have honest conversations and concerns, usually honest, relatively honest in caucus. What is it like being, looked to as a leader in the Republican caucus, trying to focus on evidence-based health policy when some of the national policy politics, rather, some of the national politics is sometimes a little more abrasive?
It is. And I think we're all thankful we're not in the national field. So I'd much rather be in Virginia, where we can make things happen and find consensus. As far as, the honest window into the caucus is that there are always dual conversations. There is what is the evidence and what is the best policy and what do we anticipate the outcomes and the pitfalls of a piece of legislation. And then the second parallel conversation is what's the political consequences and outcomes and implications of this piece of legislation. And the best place is where you find partnership on both. It's even better if you have a bipartisan team and you're able to build both the good sense, critical thinking solution and align that with the political solution. But that often doesn't happen. And sometimes decisions are made based on political issues, and sometimes they're made on principle. I'm always usually kind of in the corner of fighting for the principle, because I ran for office, and I think many of us are here because we want to see things that we think are important get done, and that's more important to us than partisanship.
I want to make sure, of course, folks watching can ask their questions. I know you're not a shy bunch, and so don't be shy about posting questions. Delegate Sickles, let me ask you a similar question, which is, in the Democratic caucus and the party writ large, there's quite a diversity these days, ranging from wholesale revolution in healthcare and more focused incrementalism. Given that breadth within the caucus, how do you work towards trying to build consensus amongst your party on issues in the House?
Well, I try to focus on practical results, what actually works. There are proposals that get introduced that are really high level, the things that we really can't do. And we have to deal with that, what is achievable within our resources here. There is always a debate about how much we can save in the future by investing now. And in the healthcare area, there's a lot of savings at the other end if we make sure children are healthy growing up and get all the treatments and the vaccinations and things they need when they're kids. And I think there's a benefit to society of having a healthcare home, and we disagree about that sometimes because we really want everybody to have the same general level of care as everybody else. Don't think there should be vast differences in the type of care that you receive based on your income or where you come from. And we have a lot of disparity in Virginia and in rural areas and our inner city areas that our caucus wants to, work on resolving. And it makes it a little bit more difficult in our delivery mechanisms, like our CSB system, if you can call it a system. So, I think I'm really interested in working with people on both sides of the aisle that want to work toward practical results that we can look to and see results the other side. And this evidence-based phraseology has been really big the last few years. And I know our Medicaid agency is using it a lot and trying to make sure we're getting the most for our money. But it is a long-term project.
Senator Lucas, how do you, my question is, how do you sort of see the politics of healthcare impacting the 2021 elections, either in the governor's race or in legislative races? Give us a look ahead about what we might expect.
Well, I think we've said maybe in different ways that we all have the same goals in mind. We just may have different approaches to how we get there. But I think overall, everybody's going to be working in a direction that's going to try to improve the quality of health care for everybody throughout the Commonwealth of Virginia. And I think, of course, that's going to require bipartisanship in terms of how we get there. But at the end of the day, we get it done.
Delegate Sickles, make sure my mute is off. What do you think about how does 2021 look for Democrats heading into legislative sessions or legislative elections?
Yeah, I think unfortunately we're not going to be able to run in new districts, and that means, I said unfortunately because that will require us to likely run 3 years in a row. We're not going to get our numbers from census to be able to draw districts until late summer, and that's not enough time for the Department of Elections to run an election in the new districts and make sure everyone's in the right district. So that is, I think our incumbents are pretty strong. We think that the issues that we've taken on are popular. I mean, our Republican friends don't think they're popular. They think we've gone too far. We think that we're in the mainstream. I mean, and that we've been behind on many of these issues, and that we need criminal justice reform. We need a better social policy, and equality for everybody. And so, we're willing to campaign on those things. And I think that we're going to have a nice battle of ideas, I guess, coming up. But I'm feeling good about our incumbents, and maybe we can even pick up a seat or two. But it's going to be hard. These are going to be well-funded elections. We're just getting started now, so we'll see.
Senator Dunnavant, I know obviously while elections command a lot of attention, that policy making doesn't stop after the session, doesn't get set aside as a result of the elections. Give us a sense of some of the, where your head is in terms of policy making in this interim period between sessions.
Well, that's my favorite thing to talk about. And so I am going to ask you to put up the slide that I sent you earlier, and I'm going to give you a little bit of a vision about how I look at healthcare as a healthcare provider. And that is predicated on years and years volunteering in healthcare space to lower cost, improve quality and patient safety. But it also comes from taking care of patients in my office. And if you look at this slide, is it up? I know I can't tell. Okay.
It is, yeah.
I am very much convinced that the social determinants of health are what we need to be talking about as we go forward. And this slide demonstrates that. If you look at this slide, only 20% of a person's health or of population health has anything to do with what we spend about 99% of our time talking about when we talk about healthcare, and that is actual care in a physician's office. And that's a really important concept, because if we really want to address the things that are obstacles to population health, we have to think about preventing the disease of chronic disease and of health risk. And so when I look at policy and I look going forward, I'm going to point out, I think these are things we can agree on. And I think that we have a preponderance of evidence that shows us that this is where we need to be legislating and developing policy. So if you look at this scale and we talk about kids, and Delegate Sickles was referencing this earlier, we need to make sure that we are addressing the needs of kids early. And we can do that. This year, I was able to get legislation in where we'll be able to provide telemedicine in schools. We need to be assessing kids in schools and screening them for all sorts of risks, whether it's childhood trauma, which is a huge obstacle to future health and success, whether it's other issues in the home, mental health issues, whatever it is. We want to make sure that we can wrap around children the services they need, not just in healthcare, but in all these other things that will help them succeed and actually have health going forward in population. One of the things we need to do for kids is we need to disassemble the zip code segregation that we have existing now in Virginia. If you have a child born in one zip code in Virginia, and we've had this data for 10 years from VCU, if they're born in one zip code in Richmond, Virginia, they are doomed to die 10 years sooner than a child born in another zip code in the same city. And that's because these social determinants of health there's such a big disparity. We should be legislating to make sure we correct those for children. If we look at this figure for adults, I totally agree with Delegate Sickles that we need to be thinking about a patient-centered medical home. We need to provide holistic care. I think that's how we can get to solving the problems of behavioral health and mental health that we have in adults. And I think we can follow suit. North Carolina is doing amazing things with advanced medical homes, where they are making sure wraparound services that intersect with all these social determinants of health are easily accessible to providers in those advanced medical homes. And so I think we need single entry into services with the state. It's such an obstacle for people to qualify for the other. When somebody comes to us and they say they're in need, we shouldn't just qualify them for Medicaid. We should see, do they need help with education? Do they need help with housing? Are they in a safe place? There's no reason they should have to apply to a different silo. And that kind of brings me to a philosophy. I think we ought to be looking at developing policy that helps our citizens, not in this kind of siloed bureaucratic way, but in a much more biologic way, where these are interactive systems that are interconnected. And so when I'm thinking about policy and going forward, you'll see that most of my policy is finding what I can capitalize on in a particular session that's addressing this vision for Virginia and the vision of population health. I think there's a lot of changes we can make in insurance. If we look down here at health behaviors, 30% of what this diagram suggests provides health, and we look at what the private sector has done with large healthcare plans where they actually have incentivized the health behaviors that help people get well, we could do that in our individual marketplace too. And I've proposed legislation that's being studied in the same studies we referenced earlier at the Joint Commission of Healthcare. So that's kind of the format and the vision for me going forward. And I think that's something that we have the evidence to support will have a better outcome than just treating disease. And I think we also have the evidence that can kind of bring us together to make this a consensus bipartisan plan.
So Senator Lucas, let me ask you, what's on your list of work that is either undone that you want to tackle now that the session's over and help build a coalition to support? Or what are the new things that you have teed up that you want to try to, have conversations about in the months ahead?
Well, as you know, I've been doing a lot of work around criminal justice reform. And in fact, there are still a lot to do with the legalization of marijuana, to include funding that we're going to be requiring for educating our people who are under 21 years old about the do's and the don'ts. And of course, that's going to be for everybody all across the board. But that's going to be one of the areas that I'm going to focus on, because I think the fact that we're going to legalize July 1st of this year, there's still a lot of educating that we need to do to the public, and especially for underage persons who might try to participate in this whole process. So I'm going to be working with that, but also trying to make sure that that all Virginians have an opportunity to drive, walk, wherever they choose to be without being harassed by police officers. I mean, so there's still a lot left to be done around criminal justice reform. And for me, that's a health issue for Black and brown people.
So Delegate Sickles, let me ask you to start this last question that I'll ask each of you to answer. Politics can sometimes be a dark place. It's also a hopeful place, and there's two sides to that coin. And coming out of a legislative session can sometimes leave people a little bit worse for wear. They got to kind of lick some wounds to get through it all. But as you look ahead to healthcare, health policy in Virginia, what gives you hope? What are you excited about as you look ahead to the next 6 to 12 months?
Thank you. I'm really excited about a skilled nursing center reform. We need to do a better job in this whole area. The Joint Commission on Healthcare is studying workforce issues related to the skilled nursing industry now. And we just need to step up and do a better job. We need to pay for it. We need to have qualified people taking care of our grandmothers and grandfathers and aunts and uncles. We have a demographic bulge coming with people that are going to need those services. And as I mentioned earlier, helping people stay out of these centers for as long as possible is part of our job too, because that's what everybody wants and it's cheaper. So that whole area of aging and healthcare and aging is something I think we can work together on a bipartisan basis and take Virginia from a very low-rated state, frankly, up to where we ought to be in that industry.
Senator Dunnavant, what gives you hope as you look out on the healthcare over the next 12 to 16 months, or 6 to 12 months?
I am very excited at looking at screening and intervention for children. I think this is the best investment we can make in the future of decreasing the cost of healthcare, improving the quality of life for more people in Virginia. And I think it's an open book. I think we have access to kids 7 hours a day while they're at school. We've never made the investment to make sure we intersect that with wellness and all other aspects of their life, or not to the extent that I think we need to. And I'm really excited that we're going to be able to change the future. You know, we really haven't changed the poverty rate in Virginia in 20 or 30 years. We haven't drastically changed population health outcomes. I think starting with the kids and making sure we take every opportunity there to intervene on their behalf is the way we move forward to a better future.
Senator Lucas, I'll give you the last word. What gives you hope as you look at the work ahead?
Well, I'm hopeful that in whatever areas we pursue, whether it's education, healthcare, criminal justice system, that Black and brown people are not forgotten. And because oftentimes, there's someone has to be at the table who says, okay, let's look at the adverse impact that all of these issues are having on Black and brown people. And so I'm hopeful that I'm going to be there, and others who have some of the same concerns that I do, to make sure that Black and brown children don't get left behind.
Very good. Senator Louise Lucas, the chair of the Senate Education and Health Committee, Senator Dr. Siobhan Dunnavant, a member of Senate Education and Health, and Delegate Mark Sickles, chair of the House Health, Welfare, and Institutions Committee. Thank you guys for doing this. I really appreciate it.